Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. It's Sunday morning. Patients haven't quite made their way into the office yet, but I got a great question on a previous video on labally displaced canines, so you know I love my canine questions. And the question was, do I think most LDCs, labally displaced canines, are mesioangulated? And if they're not, if they're already in the funnel between the lateral and the premolar, can we just simply bring the tooth in straight without having to move the tooth buccally first? Because I've said, even though you're taught in residency to move the tooth distally, then into the arch, I think you need to move the tooth buccally or labially, then distally, then into the arch. Remember, there's safety if you move outward toward the cheek. And if you just go distal, you can still shear off the distal aspect of the lateral incisor. So let me answer the question. It's a great question, and keep these questions coming. You have to think that LDCs are associated with severe crowding. So my pearl when you're treating LDCs is to over expand. If the question is, do I need more expansion? The answer is always yes. Think of the vault of a Gothic cathedral. And I think a lot of LDCs are not only associated with arch constriction, but maxillary hypoplasia, deficient short maxillas. So all the way up high into that palatal vault, those canines need room to come in, and you need much more expansion. 35, 40 turns, even if you accept a temporary buccal crossbite, that is okay. And I think, yes, a lot of LDCs are mesioangulated, and we're really concerned when that crown is near the apical 1/3 of the lateral incisor. That's where necrosis happens, and that's the aspect of the root that resorbs. Now, I've definitely seen LDCs resorb laterals where the tooth, the canine, was actually vertically erupting, and it just sheared the distal aspect of the tooth during vertical eruption. That's a patient who's just predisposed to a root resorption. That's always a challenging situation when that happens. So the pearl here, and the answer to the question is, I think a lot of LDCs are mesioangulated. You certainly can just bring the tooth directly into the arch if it's already in the funnel. Once you're in the funnel between the lateral and premolar, you're safe. I'm really concerned about the apical 1/3 of the lateral incisor. So my pearl, again, over expand. PDCs are genetically associated. The arch is usually broad. LDCs are usually associated with arch constriction and maxillary hypoplasia. Over expand, use a cantilever, bring that canine buccally or labially, then distally, then back into the arch. I hope you enjoyed this pearl. Have a great weekend. Thank you guys so much for subscribing to this page and supporting the JCO.